Dr. Chris and Jess here with Mid-Atlantic Chiropractic Center. Today we're going to talk about chiropractic and how that impacts athletics. And Jess has a really cool story she wants to share with us today. So what's going on?
Yeah. So I had always played sports. I played lacrosse and field hockey in college. So my senior year, I actually had to take a medical red shirt because I had terrible balance. I was always falling. My teammates always knew me as somebody who was falling, and I actually fell backwards right on my butt and hurt my back and was out for the rest of the season.
Wow.
Yes. So it was a pretty long road to recovery. I did some physical therapy, a little bit of chiropractic, and I still actually play now and continue to want to play forever and trying to do my best to stay as healthy as I can and not have that issue again.
Chiropractic is a great treatment option for athletes, especially if you have balance issues, because that can be what we call an afferent input issue. So that means every time you take a step, you can feel that the ground is there and it's even. You know where your foot is. So that is input going from the foot to the brain, afferent input. And if there's dysfunction with that, that can impact things like balance. So absolutely we can improve things like balance with Jess, and she'd be able to prosper as an athlete. Neurologically speaking, all the nerves in the low back, they go down to innervate all the muscles of the low back and even into the legs. So when she did fall, that could have misaligned something, and if we have misalignments there, that's going to impact the nerves that exit the spine, which could impact those muscles and recruitment of those muscles. So if we make a chiropractic adjustment to those areas, that can help to restore the proper alignment and to help recruit the proper muscles for nerve muscle firing patterns, which will help to improve your capabilities as an athlete. We have a couple tests that we use in our exams to test the patient's balance. So this first one we're going to do is walk along an imaginary line. So I'm going to have you right here.
My shoes.
Shoes are fine. And so there's an imaginary line here. What you're going to do is walk along that heel to toe. Hands down by your side, eyes will be closed.
Alright.
Okay, the goal is to stay along that imaginary line, not fall off the line. And you're doing really good. Awesome. So that's one test that we use to determine how well a patient's balance or afferent input may be. Another test that we do is the marching in place. So what you're going to do is have you stand here. Your arms will be out even, and you're going to march in place for 45 seconds typically, or until we say stop. And the goal for this one is they should be in the same spot with their arms even, and they should be facing straight forward at the end of that time period. If they're deviated to one side or another, that means that there is dysfunction with that afferent input to the brain. So give us an example here, Jess. Okay, and we'll have you stop there. So that wasn't quite 45 seconds, but as we can see, Jess was starting to turn towards the right. So if we let that go, I'm sure she probably would have continued on to the right. So those are a couple of tests that we use during our exam to see how the patient's balance is and how their brain is receiving the information from their body. If you're an athlete or you know any athletes that want to come in and get checked out, we can do tests like that on you. Come on in, Mid-Atlantic Chiropractic Center. All right, look forward to seeing you guys. Take care.